Hi everybody, it's Andrea from AndreaTooley.com, or A Doctor in the House, and today I have the video that you have all been asking for. This is my great friend Sarah Furch, who is a physician assistant, and she's here to tell you all about being a PA and answer all your questions. And so welcome, Sarah. Thanks so much for being here.
Hi, thanks for having me. I'm excited.
Yeah, why don't you just kind of introduce yourself and tell us all what you do and things like that.
Sure. So I'm Sarah, Andrea's friend from college, and I am a physician assistant at the University of Chicago, and I work in plastic and reconstructive surgery. I've been doing that for about the past year and a half, and before that I was general surgery. So
you have an amazing job.
I love it, yes.
Good. And what exactly is a PA? What does that mean, physician assistant, for those who aren't familiar with it?
Yeah, so everyone doesn't know what a physician assistant is. A lot of even my patients don't know what to call me. I'll say, I'm Sarah, I'm a physician assistant, and then they're like, okay, Dr. Sarah? Like, they don't know what to call you. But basically, a physician assistant is kind of a mid-level provider, and it's similar to a nurse practitioner, if anyone is familiar with what that is. But basically, it's in between being a nurse and being a doctor. Our scope of practice is pretty similar to that of a doctor. We're able to see patients on our own. We're able to write prescriptions, even for controlled substances. We're allowed to, order tests, interpret tests, do all that kind of stuff that doctors do. It's basically just that we have a supervising physician that we work under and that we can collaborate with. So that's the main differences.
Yeah, that's a great explanation. So how do you become a PA? Is there like a specific school you have to go to, or is it a bachelor's degree? Like, how do you get there?
So for a physician assistant, it's pretty, as far as undergraduate degrees, you get your undergrad, and it's pretty similar to what an undergraduate degree would look like for a pre-med person, pretty much all the same prerequisites. And then you apply to PA school, and if you get in, then the program is typically about 26 months. Okay. With the first 2 years being didactic years where you're doing, all the normal courses, and then your last year is spent doing clinical rotations in different specialties.
Okay.
And then it's a master's degree when you graduate.
Okay, so a little more than a year doing book work and then a full year doing clinicals?
Correct, yeah.
Okay. So when you're going to undergrad, do you have to major in something specific if you want to go to PA school?
So not really. A lot of people will, get a degree in anything and then kind of go, you just have to have all those prerequisite courses. Right. And for me, it was a little different because at Butler, they have a program where you can get in to the PA school after only 2 years. And so I didn't really have my bachelor's degree yet whenever I got into PA school, but then our bachelor degree ended up just being in health sciences. So, but a lot of the other people in my class had various degrees. There were some people who had completely changed pathways, and they had been, like lawyers, or they had been chiropractors, or all different kinds of things. So you can pretty much major in anything.
Okay, awesome. And what do you think makes people want to be a PA? Like, what drew you to want to be a PA? And then I know lots of people want to know why you would choose PA over nursing, or why you would choose PA over going to medical school to be a doctor.
Yeah, that's a good question. So whenever I was younger, I always was interested in health and going into the healthcare field. And I wasn't, I like nursing, but I kind of wanted to be more on the leading end of things. And so being a doctor kind of attracted me more, just personally. However, my dad is a doctor, and he is the only urologist in like an hour radius of my house. So he worked a lot of hours, and me, I thought that's how many hours all doctors worked. And that part of it all was not attractive to me because I want to have a family and have kids and be able to see my kids. And so I wanted something with a little bit more structure and a little less hour requirement.
Okay.
And so I found out about the physician assistant career whenever I was 16. And ever since then, I knew that that's what I wanted to do. So it was perfect for me, basically, because, the doctors and PAs, we have kind of the same, we do the same things. Mm-hmm. But PAs, I think, have a little bit more structure with their schedule and their work hours and things like that.
Right. Okay. What are your hours like?
So for me, it varies a lot depending on what specialty you go into and what kind of institution you work at and things like that. But for me, I work 7 to 3, 5 days a week, so Monday to Friday, and I don't take any call and I don't work any weekends. Now, I do work at a teaching... I know, right? It's pretty clutch. But I do work at a teaching institution, so we have residents and things like that are covering night call, weekend call, and things like that. So that's the reason that I don't do any of those things. But there are certainly PAs that do take call and work weekends and things like that.
Okay, so it just kind of depends on your field.
Exactly.
Okay. And I know, like with me, with residency, you have to pick one specific field that you want to do forever. And like I'm doing ophthalmology, and if I decided I wanted to do plastic surgery, that's not really an option, or I would have to do residency all over again. Is it the same for PA?
No, so that's another thing that's really attractive about being a physician assistant is that you don't specialize, and so you can literally, work in any field once you graduate from PA school. So, for me, like I said, I started out in general surgery and then just transitioned to plastic surgery without having to do any additional schooling or anything like that. You're pretty much just trained on the job, basically, is how it works. So, yeah, you can work in any field that you want.
Yeah, that's a huge advantage. I feel like that's just awesome.
Yeah.
In terms of people who know they want to go to PA school, who are getting ready to apply to PA school or things like that, what's the competitiveness like of physician assistant school? Do you think it's along the same lines of medical school? Like what kind of academic achievements do you need to have to be eligible, I suppose?
So I think it's pretty similar to what it would be to get into medical school. PA school has become extremely competitive these days because it's, a growing career, and a lot of people want to be physician assistants, but they are trying to limit the number of graduating PAs every year. So it's gotten really competitive. You have to have good grades, obviously, to get in. And then a lot of PAs have experience before they get into PA school. So a lot of us will become EMTs or have their CNA license or something like that where they have a lot of healthcare hours already. So for me, I became an EMT this summer before I applied to PA school. Okay. And I definitely think that helped in facilitating me getting into PA school.
Right, sure. That makes total sense. And do you have to take something like the MCAT, or is there any entrance exam? What do you have to do to get in?
So there's no entrance exam at all. It's just, I'm trying to remember, you just literally fill out an application and tell a lot about yourself. And I don't know, it may be a little different now. I'm not exactly sure, but I know that I get a lot of PA students that want to shadow with me to get shadow hours and things for their applications. So I think that it's mainly just having that healthcare experience and getting that, and then having good grades, obviously, and having all the prerequisite courses.
Okay, that's.
And then you'll typically, they'll ask you for an interview, and then you'll interview with the program, and then they'll choose, out of all the people they interviewed.
What do you wish you would have known kind of going into it? Is there anything you wish you would have done differently, or advice you wish you would have had when you were applying or when you were in PA school?
So in PA school, it's very intense. You're, doing a lot of coursework in a short amount of time. And I think that it's very similar to medical school as well. So you just need to make sure that you're prepared to work hard and spend those couple of years, really delving into it and absorbing everything that you can so that you can be the best you can be afterwards.
Yeah, because I remember when we were in college, you had already started the PA school portion of it since, like you said earlier, it was all together, your undergrad and PA school. So did you start junior or senior year?
So I started, my junior year was my first year of actual PA school.
Right. And junior and senior year, I mean, both years, I remember you working so hard and studying so hard.
Yeah. Yeah, it was, sometimes I look back and I kind of regret that I didn't just do my undergrad and then go to PA school.
Okay.
Just because I would have enjoyed those last 2 years of college a little bit more. But, I got done earlier and was able to start my career earlier, so it's worked out for me.
That's good. Is that an unusual thing that Butler has where it's all combined in a shorter amount of time, or do other schools have that?
Yeah, there's not many schools that do that. Butler is one of the few. I'm pretty certain most PA schools are just after you get your bachelor's degree, you apply.
Okay.
And then do the 3 years.
Okay. What do you think is a con of being a physician assistant? Do you think there's any kind of negatives or reasons you wouldn't choose it as a career?
So for me, there aren't really any cons, but I have heard some people and some physician assistants that have, gone on to medical school after they've gotten their PA license that have said that they just don't like working under somebody and they don't like having to answer to their supervising physician. And I think a lot of that is just based on your personality. For me, I like having somebody that I can turn to if I have a question or if I don't know the answer to something. I know that I can always ask my supervising physician. Right. So for me, it's comforting. But for some people, they don't like having to answer to somebody or things like that. And so I think that that type of personality is better served being a physician.
Right. Okay. That makes sense because you do have somebody that you kind of have to, like, how much do you have to do what they say, or how much autonomy can you really have?
So I think it's different with, every person and every institution. Some PAs work with only one doctor, and some PAs work with multiple doctors. Like for me, I have my one supervising physician, but then I also work with 6 other doctors as well.
Okay.
And so for me, I'm not really answering to my one supervising physician that much, and all of my attendings are really good. They give me a lot of autonomy, so I'm able to kind of just do whatever I want. And then if I have a question about something, then I'll certainly ask them. Or if I have a question about a patient's management or care, then I definitely ask them. But they don't make me, run things by them before I do anything.
Okay.
So, but I think maybe some physicians are a little more strict with that. At the beginning, of course, you want to kind of have a little tighter leash on on things to just make sure that everything goes okay. But I think that definitely, as you develop a bond and develop a relationship, that they trust you a little bit more.
Yeah, definitely. I feel like you would be invaluable to that physician,
Hopefully.
Yeah. Okay. All right. Anything else you think someone who might be considering physician assistant as a career should know?
Nothing that I can really think of. But, if anyone has any, questions or they want to reach out to me, I'm more than happy to answer any questions that anyone has.
Great. I'm sure people will have plenty of questions. Everybody, just leave them in the comments below and we can respond. And click subscribe to always get these videos, and we'll talk to you later. Thanks, Sarah.
Okay.
Bye.
Thanks, Andrea. Bye.